Hello, everyone. It's Rockson Liu again with Pacific Hernia Institute, a dedicated hernia surgery practice. Today, I'm going to talk about the most exciting topic in hernia surgery today, which is SP. SP stands for single port, and I am using a robot by Da Vinci called the SP robot, single port robot. The SP robot has been around since 2018, and the urologists and the ENT surgeons have been using it for their surgeries. But general surgeons really haven't used it for the surgeries that we do, and hernia surgeons definitely have not been using it in the United States. Outside of the United States, some surgeons have been using it for hernia surgery. But the FDA approved the use of the SP robot for inguinal hernia surgery in the United States on December 10th, 2025, which is why there's now a lot of excitement around it. To use this robot, a surgeon needs to be trained and needs to have a lot of experience with multi-port robotic surgery. And so it is a very different platform from the traditional multi-port robot. Let me just kind of explain what the difference between single port and multi-port is. So the traditional robotic surgery that we think of is considered multi-port surgery because I need one port or one incision and a port for my scope, for my eyes, another incision with another port for my left hand, which is usually a grasper, and a third incision with another port through it that's used for my scissor and then a needle driver. So you can see the minimum amount of incisions I need for a regular traditional robotic surgery is 3 incisions. With those incisions, the ports are 8 millimeters usually, and so the incisions are about a centimeter or 1.2 centimeters for each port. So you have 3 1 centimeter incisions. With a single port, all 3 things, the scope, the left-hand instrument, and the right-hand instruments, go through a single incision. And I've made an incision as small as 1.8 centimeters to fit all 3 things, okay? So instead of 3 1 centimeter incisions, you get a 1.8 centimeter incision. Now, the other thing that differentiates this robot is with hernia surgery, especially for inguinal hernia surgery, we have 2 ways of tackling a inguinal hernia repair. One is a TAPP, transabdominal preperitoneal, which is the most common way to do robotic inguinal hernia repair, so robotic tap inguinal hernia repair. There's also TEP, totally extraperitoneal surgery, which was a very common way to do a laparoscopic repair. And the totally extraperitoneal repair involves entering the space where the mesh is going to be. Traditionally, with laparoscopy, we use a balloon to create that space, or we take the scope and kind of sweeps through that space, and then put in our 3 laparoscopic ports and do it laparoscopically. When the robot came about, because of the precision of the robot, the better ergonomics, the magnification, the tremor filtration, just the overall precision with the robot, surgeons abandoned the lap tap and did more robotic tap inguinal hernia repairs. However, the potential downside to a robotic tap inguinal hernia repair is I have to put incisions through the muscle. All 3 incisions go through muscles, so that could hurt more. I have to enter the abdominal cavity, so there's a potential for injuring the intestines that live in the abdominal cavity or the liver or the stomach. And then to get into the space called the extraperitoneal space to put the mesh in, I have to make an incision in the inner lining of the abdominal wall called the peritoneum. And that peritoneum has nerves, so there's sensation to it. So when we make an incision, that can cause pain. And then when we close it with stitches, that can cause pain. So those 3 things make the tap operation not quite as ideal, but the robot lets us be so precise and so bloodless that the ultimate operation is better than the laparoscopic tap. I can create the right size pocket, put in the right size piece of mesh. I can be more gentle with the tissue. I can be more precise with the dissection. So the mesh is in better position so that the recurrence rates can be lower. There's going to be less trauma to the testicular structures, the spermatic cord, and there's going to be less chance for nerve injury, which is why I prefer the robotic tap approach. But I've always liked the laparoscopic TEP because I'm not going into the abdominal cavity, I'm not making that peritoneal incision, and I'm directly entering the space where the mesh is. I don't have to enter the abdominal cavity, and I'm not penetrating muscle, so there should be less pain. So when the SP was approved by the FDA, I became very excited with the concept of potentially performing an SP TEP inguinal hernia repair. Now, there were very few examples. There's a surgeon named Philip Moisems over in Belgium who has done a few of these operations, and I heard that a few surgeons in Asia were doing these operations. So I actually went to Taiwan and watched Dr. Fang perform an SP TEP inguinal hernia repair, and I fell in love with this operation. So I petitioned Intuitive to train me. The FDA approval came very quickly, and they were kind of caught off guard in a way. So they did not have a training pathway, but because I'm a very skilled robotic surgeon, they knew that I would be able to take on this new platform and new procedure and be able to perform it well. So they created a special training pathway for me. So I was one of two surgeons who were the first to train on the SP robot after FDA approval. And I performed my first operation on May 1st. And it was just an incredible operation, as good, if not better, than I had anticipated. The SP robot lets me be even more precise than the multi-port robot, and let me operate through this little tiny incision at the belly button, such that once I was done, the incision was essentially hidden in the belly button. So it's almost like scarless surgery. And I was able to fix, I had several cases that day. I was able to fix a unilateral inguinal hernia and then a bilateral inguinal hernia, and all the operations have gone very well. Today is July 3rd, and I've done 8 of these operations, and they have all gone extremely well. Recovery has been faster than I had anticipated because, as I mentioned earlier, not penetrating the muscle with the ports leads to less pain at the port sites. Not having to make an incision in the peritoneum and not having to close the peritoneum is leading to less pain. And not insufflating the belly also leads to less diaphragm, and you may have heard of patients getting shoulder pain from insufflation of the belly. So I've noticed that patients are recovering faster and having less pain. One patient actually did 75 push-ups, I think 5 days or a week after surgery, and dunked a basketball, I think about 3 weeks after surgery. So just incredible results with this new SP platform. Of course, I've only done 8 patients hernia surgery, so I really need more patients to see if this is a real trend. But so far, things have gone really, really well. Now, what I'm even more excited about is using the SP for ventral incisional hernia repairs. So in those 8 patients, one patient had a midline ventral, an umbilical hernia, and an epigastric hernia, plus an inguinal hernia. So I made a 2.5 centimeter incision just above the pubic bone, so below the bikini line, essentially. So it was a hidden scar. And through a 2.5 centimeter incision, I was able to fix the umbilical hernia and the epigastric hernia. And the robot can rotate 360 degrees. So through that same incision, I was able to fix that left inguinal hernia also. And he has done very well, very happy with the operation, very happy with the cosmetic result, and essentially scarless surgery. So if you want to find out more, I do have some surgical videos online. Those are meant for surgeons, but you can certainly watch them on YouTube. I will be glad to see you and see if you're a candidate for SP hernia surgery. I'm, of course, looking for patients to do more of these SP hernias on. If you have a small or medium ventral hernia, if you have an inguinal hernia, you're definitely a candidate for SP if you haven't had previous surgeries for those hernias. Stay tuned. I will certainly talk a lot more about SP, and the suprapubic variation is called SP squared, as a term coined by Philip Moisems. SP squared is suprapubic single port, SP times SP, so SP squared. All right, take care.